Good morning, everyone. And first of all, thank you so much for being here today, both here live and in many of our stations, on our big screen, on Facebook Live. We've got the whole hospital and all our satellites tuning in. So first of all, happy birthday, Boston Children's Hospital. I'm Sandi Fenwick, the Chief Executive Officer of this wonderful institution, and today, March 22nd, in 1869, the charter incorporating and establishing Boston Children's Hospital, then known as the Children's Hospital, was signed. And so today is actually 150 years ago, the day of our birthday. So today is truly a happy birthday. 4 physicians had written up a plan to establish a children's hospital in the city of Boston to carry out 3 objectives: medical and surgical treatment of diseases of children. Listen to these words: attainment and diffusion of knowledge regarding diseases of children, and training of young women in the duties of nursing. Yay, women. Were they prescient? Were they pioneers? Were they architects of a culture that absolutely would never say never? I would say absolutely. And when you think about it, care, research, education, and community, the 4 missions of Boston Children's Hospital are still growing as strong as ever today as they were back then when they thought about the way a place like a children's hospital could impact the world. It's impossible to actually calculate how many children's lives have been impacted since the founding of this hospital 150 years ago. From the initial pledge in 1869 to, quote, care, treatment, and cure for the children of Boston, we have worked tirelessly to provide a better world for kids. Kids back then and kids today, and we know for kids tomorrow. For all the twists and turns that our history has taken and our story unfolds since 1869, the one thing that has truly never changed is the commitment of the people who have been not only here from the beginning, but also the people who are here today. It's that commitment that really makes this place a very, very special place. It's the commitment of the people of Boston who come here and have been here and then stay here because they want to make a difference. They want to know that they will have impact. They want to go home at night or stay here all night and know that they are making a difference in the lives of children, not just children today, but the children that will come before us, that have come before us and that will go before us into the future. John Adams once said, there are 2 types of people in this world: those with commitment and those who require the commitment of others. The story of our first 150 years, and hopefully the story of our next 150, is really about those 2 types of people. For 150 years, families have come from around the world seeking answers, seeking treatments, and hopefully seeking cures. They've come because of our commitment to care for them as if they were our own, to give them hope when they've had none, to make them feel at home in our own family when they can't be with their own, to spread our knowledge so they can receive care in their own communities. And when there are no answers, when there are no treatments, when there are no cures, to know that we will never stop. We will never stop searching until we have an answer, until we have a treatment or a cure. And so for 150 years, Boston Children's has been home to those nurses that were described, and the doctors described, and the teachers that were described in those early words: scientists, caregivers, and all of the wonderful people who support them. Thousands upon thousands of people who have come through this institution, who are here today, and who we know have been here rising to the challenge that families and children have brought to us. Families turn to Boston Children's because they need that kind of commitment that will really never waver. And we know we will have constant people who will come as trailblazers, as pioneers, who hear that something can't be done. But in our words, it's only because it hasn't been done yet. They need a team that never settles for good is good enough. And as we all like to say, to make the impossible possible. And for all of that, it really is a great thank you to the people who came before us and for all of you who are out there, who are making history today and who are changing the lives of kids and improving the lives and quality of life for the families. So thank you all. I'd like to really share a lot more about our history because the history is so unbelievably rich. So stay tuned because we will be creating a book of all the wonderful firsts that have come out of this incredible place. And somewhere around June, this book will be launched, and many of you will be in it. And, but today, since we don't have the time to go back to talk about the present or to really talk about where we're going for the future, there's no one better than the patients or families who've been through this place, who can describe what their journey has been like coming through Boston Children's. And when we leave this place and we watch children leave, we have a hope that the children will not only thrive, but they will go on to do really great things. And there's no one who better epitomizes that than our mayor of Boston, the Honorable Martin J. Walsh, who's here to share a few words with you. Thank you, Mayor.
Thank you, Sandy, and I want to thank everyone here at Children's. Happy anniversary. It's an honor for me to be standing here today. It's funny, it's been a long week, and I was just saying to Sandy, we've had a lot going on in the city, just good stuff and crazy stuff and life stuff, and it didn't hit me till I walked through the doors here what really matters. Life goes on, and we all have our ups and downs and tough days and good days and bad days. And then when I hit the door and I saw Sandy, I realized that what really matters is sometimes we get so crazy about things that really don't matter. And so it's an honor to be here today. I'll get more into that. I want to thank and congratulate all the doctors and the nurses and the patients, the staff, the maintenance folks, the valets, everyone that has anything to do with this hospital. Thank you for all of your incredible work over 150 years. I'm looking forward to hear other patients talk about their experiences here, and you know, it's amazing. This hospital means a lot to me. I was looking at the picture here from 1938, and I think that that's the emergency room that I went into in 1974. I was sick, I was tired, I was laying down, I was losing weight, and my mother took me to children's emergency room one night, and I think they thought it was appendix, so they kind of sent me home and, you know, keep an eye and come back. And the next night I had pain again, and they brought me in, and they realized that it wasn't an appendix. It was something much more than that. A few days later, or whatever time it was afterwards, they did surgery, and they found out that I have a mass in my stomach. I was 7. I was not the normal 7-year-old because I wasn't playing the way I should be. I was tired all the time. And what they did was they basically did exploratory surgery. They closed me up and they said to my mother and father, you have an option, a couple options. One is we can try and make his life as best as possible, or we can try an experimental drugs. And my mother and father obviously took the option of experimental drugs. And for the next 4 years, I was treated at the Children's Hospital, the Dana-Farber, the Peter Ben Brigham, for radiation and chemotherapy. I was at the old Jimmy Fund when it was just a little clinic on the corner, and I was at the Children's Hospital before some of the new buildings that are here and the new buildings that are coming. Didn't quite understand, because as a kid you don't really understand the magnitude of how sick you are. But the experiences I remember I remember them very clearly. I remember a lot of the procedures that the doctors did on me. And I'd like to thank Dr. Martin Fosberg, who was a doctor in this hospital. I think he retired and became a farmer up in Maine. That's what I heard last. Dr. Cassidy, he was in radiation, I believe, and he was one of the team that worked, I think, on the second floor in the old building. You go up the stairs into the old building. I remember being in his place, lining me up for the dots for the radiation. The nurses, I don't have all their names, and the people that my family had a chance to come across and experience. Father McCarthy was a chaplain here at the hospital, and he'd come into me and visit me in the room and visit other kids. Back in the day that we was on, Division 24 had an 8-room ward. Division 28 had a 4-room ward or a 2-room ward or a 1-room ward, and you didn't want to be in the 1-room ward. I didn't realize that at the time. I was in the 1-room ward. I was in there because I had double pneumonia and I was weak. All of those things, when you think about it, I didn't think about at the time, but really helped create who I am today. This is a special place. There's also another family on the same floor as me that a kid around the same age as I did, and he didn't live. But his mother went to work at the Dana-Farber, and every time I'd go back to the Dana-Farber for a checkup, my mother would tell the story about her son. So for some of us, there's a lot of happy memories, and for some of us, the memories aren't as happy. But the thing that's unique about all of this experience is that the doctors and the researchers and the nurses and the medical people here never stop, constantly trying to find a cure for whatever it is. Make sure the families have good experiences here whenever they come through the front door. And a lot of us love you for that, for what you do. We're blessed to have Children's Hospital in Boston. This is the greatest children's hospital in the world. It doesn't matter what the rankings are. Some years we're ranked #1 by some ranking agency, and some years we're ranked #2 by ranking agencies. But we know in our heart and in our city that we're number one hospital in the world. And that's because of a lot of great, incredible people, from a nurse in 1902 that thought about how do we do something special for our young people, from the 4 doctors that created this institution, to the doctors in 1938, to the doctors in 1974, to the doctors in 2019. And, you know, as a city, I'm grateful for being able to be the mayor of the city of Boston, to be able to continue to not just celebrate today, but be able to continue this great tradition here in this unbelievable hospital. When the controversy happened around the Prouty Garden out back, there was a lot of emotion around that. And I remember being a kid, being out in that garden. And any time that I had a chance to visit this hospital, I'd take a walk out that garden, because that garden didn't change from when I was 7. But when it came down to an understanding of creating something even more for the family's experience, in the sense of comforting the family and comforting patients and allowing us to be able to have individual rooms for families to be able to come in, that's something that's really important. Because my parents couldn't stay with me because there was 8 other kids in the ward. And oftentimes parents, I remember parents coming from places like New York and New Hampshire and places like that, and they didn't have a place I think it was the Ronald McDonald House down the street, had just been built or being built right around 74. So there wasn't a place for families to go. So what they did was they slept in the hallways of the stairwells. And to be able to be part of creating an opportunity for parents not have to do that today, and to give kids the best opportunity for them for recovery, to keep them safe and keep them in a healthy environment, but also allow them the opportunity, families, to be there. That's really important. So I'm grateful to be part of seeing this hospital expand. I'm grateful for the breakthroughs that this hospital has made over the 150 years in measles and polio viruses and heart surgery and chemotherapy and Burkitt's lymphoma. Because in 1974, the survival rate, I believe, was somewhere between 15 and 30%. And in 2019, the survival rate is 90+%. That's a very short period of time to have such a big jump in a survival rate. And all the other childhood leukemia and all the other diseases and sicknesses that young people get, little ones get, we all get, it's something that the hospital continues to work on. I can't imagine what this hospital will achieve in the next 150 years. It will be absolutely incredible what this hospital will achieve. and be able to make experiences that I had and some of the other patients I'm going to speak today, not have to go through what we went through, because we'll be completely different in 150 years. And the reason why it's going to be completely different in 150 years is that 150 years ago, 4 people sat down and started something, having no understanding of where they would be 150 years later, and seeing what we're talking about today. So I just want to thank everyone that's here today. I want to thank Sandi, the president, who does an amazing job here. And I want to thank you for your friendship. I want to thank the board of directors for your commitment to this hospital. I want you to continue to be committed to this hospital. And to the patients that are here and the families that are here, I want to thank you and say that we're with you and we stand with you and we walk with you every single day through your journey, because it is a journey. To the doctors, thank you for your incredible work. To the researchers, for your incredible work. I want to give a special shout out to the nurses, because the nurses are the ones who always, like, when times are tough and you're sick in the bed and you're a little kid, it's the nurses that really comfort you. Not sorry, docs, but it's the nurses that come in and comfort you. So I want to thank the nurses as well for comforting us. And I have a official proclamation, which I'm not going to read the whole proclamation because it's just there's better speakers coming behind me. But March 22nd, 2019 marks the 150th year of Boston Children's mission to make life better for children and families everywhere. Now, I, Martin J. Walsh, Mayor of the City of Boston, a former patient of Children's Hospital, do hereby proclaim March 22nd, 2019 to be Children's Hospital Day in the City of Boston.
Good morning. I am Fred Lovejoy, the Associate Physician-in-Chief in the Department of Medicine. Mayor Walsh, Sandi, Fenwick, marvelous patients, and our incredible staff and administrators of Boston Children's Hospital. What a grand day this is. Mayor, thank you for your heartfelt and inspiring words. 150 years of serving children of Boston, and now sick children throughout the country, and for that matter, throughout the world. What a marvelous history. We have so much to be happy and proud of. I arrived here at Boston Children's Hospital as a budding young resident 50 years ago. I know when you look at me today, it looks like it's just 10 years. But caring for children keep you very young. What a privilege to serve such a grand institution. Let me point out some remarkable firsts. One of the first pediatric training programs in the United States, with the first house officers admitted in 1882. One of the first pediatric nursing schools in the United States, established in 1889. One of the first social service departments, and one of the first physical therapy departments, both in the early 30s in the United States. And today, the first sports medicine department and the first and largest otolaryngology department in the United States. And what of some firsts in childhood diseases? Robert Gross, surgeon, and the first open heart surgery in a child in the United States in 1938, opening the possibility of operating on infants with congenital heart disease. And Randolph Bars, pediatrician, and Elizabeth Lord, psychologist, discovering the ingestion of lead paint by children can lead to mental retardation, with essentially its total elimination by the lead prevention laws of today. or John Franklin Enders, research scientist, growing the polio virus at the Children's Hospital, paving the way for Salk and Sabin polio vaccines, the Nobel Prize, and the saving of untold numbers of children afflicted by polio. Or Sidney Farber, pediatric pathologist, and his pioneering work, and the Jimmies of the world afflicted with cancer. Today, the Dana-Farber Cancer Center, and the remarkable oncology and transplantation wards at Boston Children's Hospital. So many children cured from their cancer or living longer or more productive lives. And what of the wonders of today? Successful kidney, lung, bowel, heart, bone marrow transplantation. The medical informatics revolution, and the new horizon of gene therapy, and the best-ranked children's hospital in the United States by U.S. News and World Report for so many years, reflected upon with quiet pride and with deep humility. But the work is not done. There is so much more to do. To be able to labor in the vineyards of healing of the Boston Children's Hospital is what we are all about. With our rich tapestry of talented and caring nurses, physicians, pharmacists, social workers, physical and occupational therapists, imagine what they will be saying 150 years from now, and what amazing wonders will have been achieved. So, happy anniversary, Boston Children's Hospital. And now it's my privilege to turn the microphone over to some of our truly remarkable patients who will tell their stories. Thank you.
So my name is Corey Peak, and I like to say I was the first primate to receive bridge-enhanced ACL repair during the phase 1 clinical trial run here at Boston Children's Hospital, looking at a new tissue engineering approach to repairing ACLs. After tearing my ACL in a skiing accident 4 years ago, I was concerned to learn that 80% of people developed arthritis in their knee 15 to 20 years after the conventional ACL reconstruction method. As the 25-year-old at the time, the idea of developing arthritis at 40 or 45 seemed way too soon. Luckily, I learned from a friend that Boston Children's Hospital was trying a new surgical method that could heal my original ACL. Only a little offended at how young they thought I was, I looked it up anyway and met with the clinical team to see if it was something that was right for me. The whole care team, from Brett Flutie to Dr. Martha Murray, to Dr. McKaylee, were just fantastic. As I learned more about the surgery, I can vividly recall a conversation I had with Dr. Murray. After sending her a long list of questions in an email, I received a call from her right away, answering all of those questions. She assured me that the #1 goal was for me to have the best recovery possible. To her, I was first and foremost a patient, not a participant. I felt like I was the only patient that they were taking care of in their busy clinic, and I had a speedy and fast recovery. Since the surgery, I wrapped up my dissertation in Boston in my final 2 years, but not before I met the woman who would become my wife, Isabella. So no joke, when we first were connected, and she learned my name, she Googled it and found a YouTube video of Dr. Murray and I discussing the trial. This was the very first time she had heard my voice. Isabella and I are now living on the West Coast and have an active lifestyle. And even last year, I was able to complete an Ironman 70.3 triathlon in the beautiful and mountainous St. George, Utah. I'm very proud to be part of the Boston Children's Hospital family and to add my story to its 150 years of achievements. Thank you.
Hello, my name is Haley Hutchings, and I've been a patient here since 2012. To share more about my experience, I spent much of my early childhood in and out of hospitals due to a congenital birth defect. I had many years symptoms-free, but 6 years ago, my senior year, my health began to decline, and I had trouble eating and breathing. I was referred to BCH, where a team of doctors were the only one in the world making significant advances in the surgical approach to repairing esophageal atresia with long gap. I became the first person to ever receive microvascular supercharged jejunum. I will always remember the first time Dr. Jennings gathered his team to share with me and my family the details of how they would approach my treatment and care. It was in a Skype video call from my hotel room in Madrid, Spain, where I was vacationing with family. From the start, I felt like it was important to everyone involved with my care at BCH that I had an active voice and role in how we moved forward. Doctors and support staff made themselves readily available for me to answer any questions or concerns I had. During my 4-month hospitalization here at BCH, my family and I developed many meaningful relationships with the doctors, nurses, child life specialists, social workers, and others involved in our care. The passion and dedication that Dr. Jennings and the entire EA team had to improving the lives of children born with esophageal atresia was obvious and sustained my family through many dark and difficult days. One memorable experience that stands out was Dr. Manfredi's heroic feat of securing backstage passes for me to meet my idol Taylor Swift before a concert at Gillette following my much anticipated and earlier than expected release from the hospital. Following my lengthy hospitalization, the esophageal and airway team asked if I'd be willing to share my challenges and experiences with other patients and families who were considering undergoing the same procedure. Through this opportunity, I had experienced tremendous personal growth and satisfaction in giving back. I also discovered my own passion for improving the lives of children born with EA. I recently graduated from Boston University with my master's in child life, and I'm looking forward to leading by the example set for me here at BCH. Dr. Jennings and the entire EA team will always remain near and dear to me and my family.
Good morning. My name is Sharika Elliott, and I'm the mom of an amazing little boy named Tiandre Cephas Harris. Tiandre began showing signs of asthma at 8 months. As he got older, I noticed more frequent hospital stays. It seemed like we were at Children's Hospital every other month. Tiandre is now 7. During those years, he was hospitalized at least 27 times, intubated 4 times, and has had 2 brain swells, in which his second severe attack was touch and go for him. At this time in my mind, I was about to lose my son to a disease that had that had plagued my family for years. Tiandre was finally diagnosed with a rare form of asthma his doctors call severe persistent asthma. This form of asthma is more severe than the normal form of asthma because my son has mutating cells. The best way for me to explain this is when Tiandre is having an attack during the time his cells are mutating, the cells tell the brain not to react. It's a false alarm. When in fact Tiandre is having an asthma attack, which also means carbon dioxide becomes trapped in his blood, now starving his blood of oxygen. In this event, this type of asthma Tiandre has is life-threatening. Now, I know that may seem a lot for someone so young, but you don't know my son. He's a strong-willed little boy. I need you to understand that Tiandre is my inspiration. No, better yet, he's my hero. I've watched my son struggle with asthma since he was 8 months old. Excuse me. Sorry. And never did he show any type of fear. Throughout all of this little boy wakes up smiling every time. When he sees me sad, he always tells me, "Mommy, look, I'm okay now. can I have some Oreos, please? His favorite snack. Now, knowing how close to death he was, he smiles the brightest smiles and never once showed fear. Never once gave up. He fought his way back to being healthy again, sorry. He has taught me to never, ever give up and to fight fear but to smile and always have hope. This is why my son is my hero. Since we've been patients at the Community Asthma Initiative, they have shown me many ways to keep my house dust and mold free by showing me which cleaning products to use and ways to keep the dust from coming through the vents. They provide my son with air purifiers, vacuum cleaners, and lots of other helpful items like cheesecloths, Murphy oil soap, baby laundry detergent, turtleneck face masks to cover his face during the winter, which is a major trigger for Tiandre, plastic bins, hyperallergenic beddings, and most important information is to stop smoking. Tiandre's lungs do matter. I want to thank his wonderful and amazing medical team. I don't know how I could have gotten through all of this without your help and support. Without you, we wouldn't have been able to celebrate Tiandre's second year of being hospital-free. Tiandre is now on the men's BU basketball team. He has practiced with the team, goes to their games, and his favorite hangout spot, the locker room. Tiandre goes outside to play more and has less attacks and is able to run, play, ride his bike, and play outside with his friends instead of looking out the window feeling sad. Thank you for all your help and support to the CAI team. You guys rock. Thank you. It also says, can you guys please stand up and take a bow?
My name is Jennifer Salvucci-Bent. My husband Keith and I came to Boston Children's Hospital on December 2nd, 2015. We were seeking a second opinion in the Advanced Fetal Care Center after another major Boston hospital told us that our daughter Charlotte was, quote, missing part of her brain during my anatomy scan, and then upon completing a fetal MRI the next day said that she did have her whole brain but had congenital hydrocephalus. We knew we had to come to the best pediatric hospital in the world. And when you come to the leading pediatric hospital in the world, you get to have a doctor who pioneered a surgery for the very thing the other hospital claimed Charlotte had. So yeah, we trusted him. That doctor is Dr. Benjamin Worf. And what he told us that day changed our lives forever, bringing back hope after it had been taken away. Dr. Worf told us that Charlotte had had a brain bleed in utero, and that had led to enlarged ventricles, but that she did not have congenital hydrocephalus. The second doctor we met at Boston Children's Hospital was Charlotte's neurologist, Dr. Christopher Elliott, who quite possibly has answered 3,424,000 questions by me since 2015. Dr. Elliott has been with us since our journey began at Boston Children's Hospital. He has been by our side, cheering Charlie on since she was a fetus, and that is why we feel comfortable and taken care of. It is still hard for me to think that my daughter has to be in the care of a neurologist. That isn't what most parents-to-be think about during pregnancy, if their child may have neurological deficits. And it certainly was never on our radar during the beginning of our pregnancy. However, being surrounded by the best pediatric healthcare professionals in the world made it a little bit easier. The fact that our nurse, Donna, in the Advanced Fetal Care Center, still keeps in contact with us today is a prime example that my family isn't just a number to Boston Children's Hospital. We're part of the family. Being part of that family means you get to see the inner workings of a hospital that not only provides stellar care for children, but also is a place where joy can be found. The doctors, the nurses, child life services, volunteers, they have made the hospital stays and seemingly endless appointments enjoyable. They have created a safe, warm, and inviting place for both of our daughters. Charlotte and her older sister, Alexandra, feel at home here, to the point where Alex requests the activity rooms on the floors when we were just here for a routine doctor's appointment. Yep, they're that good. Whether it's a doctor staying as long as necessary, especially in the early days after birth, to explain things to us, things like bilateral perisylvian polymicrogyria, things like that, where you just don't understand, or sitting in one of those aforementioned activity rooms talking to a grandmother whose granddaughter had been complaining of a headache on a Friday, and had had emergency brain surgery for a tumor on a Monday, and she had survived, and her doctors, the grandmother told me that day, had made sure to come by multiple times a day to talk to her parents and the girl to make sure she felt safe and taken care of. Yes, this is a place of miracles. I really do believe that. Someone asked us how our life has changed since coming to Boston Children's Hospital. I'm going to be brutally honest right now, and this honestly may be hard for some people to hear. The other hospital had told us that our daughter would have no quality of life, so we were preparing for termination. So to answer that question, Boston Children's Hospital saved our daughter's life. Thank you.
Good morning. My name is Bobby DePascanaus. My sister Claudia DePass unfortunately could not be here today as much as she wanted to be, so I will be telling her patient story. My first sickle cell disease crisis on American soil is what brought me to Boston Children's Hospital. It was November of 1972, and I was 6 years old, not too long after arriving in Boston from the warm climate of Jamaica. My experience at Boston Children's was mostly positive. I say mostly because the flip side of that is the pain I experienced whenever I experienced a crisis. They were always so intense. When I was a child, I never just mild, but always had to be off the charts and beyond a 10 on a pain scale. But I would remember being treated immediately in order to provide me with much needed relief. For a kid in my situation, it was like magic. Instant pain relief. My sister may not remember this, but she once said to me as we were in the emergency room right after I received my IV pain medication, "There is no way it works that fast." I remember thinking, I am so grateful it does. Children's Hospital created an inclusive, loving, and caring environment for patients and families. I remember one particular office visit with my hematologist, Dr. Ora Platt, when I asked if I could draw labs. Imagine my surprise when she said yes. I thought it was the coolest thing. She was an inspiration throughout my childhood and entire life. She was always honest with me and helped me navigate my adolescent years. Our relationship continues to this day, and I truly love her. My experience as an inpatient went beyond being treated for my disease. The staff created a safe home away from home because we spent so much time there. The director of activities, Evelyn Bird, helped create a family with other patients and their families. We knew each other because we were always admitted to the same floor, Division 37. We cared for each other and developed as a family and were there to comfort when we experienced a loss. Since coming to Boston Children's Hospital, the impact it's had on my life was to give me hope and the ability to have a future that I once used to dream about. It turned my dream into reality. Had it not been for my mom taking that leap of faith, I would not be standing here today. She knew that moving to this country would mean that we would have a better future, and I am forever grateful to her. She had a vision, and as it turns out, hydroxyurea was a part of that vision for me. I was introduced to the drug in 1982 at age 17. I needed a dramatic change in my life, as my last couple of years in high school were spent in the hospital or at home as I recovered from my most recent hospitalizations. My mom and I weighed the risk, but the benefits were far greater. I wanted to be like my siblings, normal and contributing members of society, as were our parents. So it was an easy decision to enter the trial. I had more to gain than I had to lose. Being the first in the world with sickle cell disease to receive hydroxyurea never entered our minds. Once that was made clear to me, it blew me away. I wish my mom was here. Incidentally, my sister Claudia will be 54 this year on Christmas.
Good morning. My name is Jennifer Miller, and in 2001, I was about 18 weeks pregnant with my second child. I was feeling much better than I had with my first pregnancy, and my husband, Henry, and I went to the ultrasound with complete confidence. It was a boy, we learned, a boy we had already named Jack. But Jack wasn't completely cooperative during the ultrasound. They couldn't quite see his heart, and they couldn't quite tell us that his heart was developing normally. So they scheduled a level 2 ultrasound, and we remained confident. You can tell when something goes badly wrong at a level 2 ultrasound. The atmosphere in the room changes. People hurry in and out. They look at you differently. In that small ultrasound room, Henry and I were told that Jack had a very serious and potentially fatal heart defect, hypoplastic left heart syndrome. Over the remaining weeks of the pregnancy, we were told Jack's narrowed aortic valve would cause his left ventricle to deteriorate to the point where he would be born with, essentially, half a heart. When parents are given a devastating diagnosis, they fear that everything normal about their lives has been lost. A normal life for their child and their family, filled with all the usual experiences and joys. But with that diagnosis, suddenly you imagine the years stretched out in front of you, filled with surgeries, medicines, and doctor's appointments, and maybe worse. That was our frame of mind when we called our practitioner with the news of Jack's diagnosis. She immediately encouraged us to seek advice at Children's. Here, we learned that we had some standard options, none of them great. The most hopeful option would have required 3 open heart surgeries and would not have guaranteed Jack a reasonable quality of life. But there was one more option, what cardiologist Wayne Turetsky called the science fiction option. A team from Children's and the Brigham could attempt to widen Jack's narrow aortic valve before he was even born. One needle through me, through Jack's chest, into his heart, and ultimately his aortic valve, with a tiny balloon widening that valve. It was the standard treatment for the condition after birth. The hope was that if they could do it before Jack was born, the increased blood flow across the valve would allow his heart to develop normally. But it had never been done before, and the results of the previous attempts were not encouraging. As the front page of the New York Times would later report, we chose the science fiction option. Despite all the unknowns and the staggering technical challenges, it made sense to us, and it provided the best chance for Jack and the whole family to recapture the normal life we feared was lost. As the New York Times also reported, the procedure was a science fiction success. Jack was born at about 33 weeks with both ventricles intact. They pronounced him robust, and with that, normal was again a possibility. Flash forward 17 years. Jack is a junior in high school, looking forward to college. He drives. He's been active his entire life. He boxes, he bikes, he skateboards, he surfs. He's played competitive sports since he could dribble, and he now starts for his high school varsity baseball team. None of that gloriously normal teenage boy existence would have been possible if we hadn't walked through these doors. And no part of our family's totally normal life, where most of our worries are mundane and our joys are many, would have been possible without that science fiction success. And we are just one story, just one of countless successes that this great institution has seen, all of which have brought the possibility of normal back to families badly in need of it. Thank you. And I just want you to, Jack is here today, so he's going to stand up and say hello. Just a quick wave. There we go.
Boy, I don't know about you, but it takes my breath away to listen to your stories. And first of all, thank you. Thank you for your willingness to share your stories. Thank you for your faith in Boston Children's and our people. And we're so glad to hear that so many of these stories have turned out so beautifully. Thank you. You know, there's always two sides. there's always two sides to a story, and I'm really thrilled that some of the very important people who have been the other side of this story are here, and I'd like to ask, in addition to the ones that have already been asked to stand, if you could just hold your applause. I would like to just have them all, if they're here, please stand. Dr. Rusty Jennings, the surgeon who did the esophageal atresia. Dr. Ora Platt, that was mentioned as the hematologist who was very involved in care. Dr. David Nathan, I don't know if David's here, but it was David who suggested the hydroxyurea for sickle cell. Dr. Martha Murray from our BEAR program. Dr. Lyle McKaylee, who actually did the surgery on Corey. Dr. Christopher Elliott, who was involved right here as a neurology neonatologist. And Dr. Sherry Nethersall, Elizabeth Woods, and nurse practitioner Linda Haynes in the asthma initiative. Thank you all. So obviously there have been many people who've been involved in not only planning this day, and I'd like to do a shout out to the committee and the people who've made this day possible. We've got lots more going on for the whole rest of the year. We're going to make this today a rolling rally and get through the whole rest of the hospital, going to literally all our satellites and all our departments. But I just hope you'll get a chance also to look at the fabulous cakes that we have here. Our original site on Rutland Avenue in Boston, that was really the original site in 1869. Our Honeywell building, that was the first location here on Longwood in 1914, and our soon-to-be completed Hale building. And, you know, obviously we don't have our whole campus, but it's an incredible, beautiful set of cakes that commemorate this wonderful history. But as we look back and we say, how do we show tribute to the people who have come before us and all the people who have made the most amazing contributions to the patients and families. I just want to talk about our future for just one moment, because this place really, truly is never satisfied. It is a place that is constantly looking for what we can do next for the patients and families. We're never satisfied that the quality of life for children is what it could be. We're never satisfied that we have treatments and drugs and devices and cures. And we are right on the edge of some of those right now. Cures that we hope will truly change the lives of children, not just today, but in the future. And so thank you to all of you. Thank you for not only what you've contributed to the last 150 years, but also to the next 150. Because as the mayor said, I don't think any of us can imagine or can even dream of what the next 150 years will look like. So thank you for all being a part of it. Thank you for what you do every night, every day, every hour of every week for the kids and the families today and for their future. So thank you all. And we're done.